Have you been stuck in the same cycles of Achilles pain, doing endless calf raises, taking time off, only to feel the pain come right back as soon as you go straight back into jumps or sprint? It's super frustrating, right? Almost as if the Achilles is basically holding your whole athletic potential hostage. So today I'm going to show you how to break that cycle once and for all so that you can return to the sport that you love and without worrying about the pain every time that you perform a step or when you jump. So in terms of Achilles issues, there's actually two types of it. So there's one that is nearer to the bottom of it, and there's another that's kind of around the middle of the Achilles. Okay, so the first type is the insertional Achilles tendinopathy. So that's basically closer to the heel bone right here. So you can probably feel it around here right on the edge of the bone. And for the other type, which is the mid-portion Achilles tendinopathy, you probably feel it right in the middle, so maybe 2 to 6 EM above the Achilles. So let's talk about the insertional Achilles tendinopathy first, all right? So what are some of the aggravating factors for that? So for the first one here is going to be a lot of compressive load. So for the pain that you get maybe closer to the heel bone, right? Doing a lot of stretches, maybe in these end ranges, trying to really tug onto the Achilles right here is probably not a good idea for you to initially start off with. Maybe doing some uphill running, and that is probably going to really tug on that insertion right there, right? And it's really, really sensitive when you do some end range stretching. So even like putting your feet up against the wall and try to just stretch out your calves, that's going to be a lot of compression around that area. So it's not going to be feeling very good afterwards, and it might actually aggravate some of that pain that you've been feeling. And for the mid portion Achilles tendinopathy, you probably feel it whilst you're doing long distance running, maybe some type of jumping, and even prolonged standing. And for, stretching, right? Maybe if you're kind of just doing stretching for the calves, it actually won't be as bad because it's not actually compressing the heel bone area. Because let's say if we actually pull out an anatomy picture here, right? Your tendon is basically between your skin and your heel bone, right? So if you're actually trying to stretch the life out of it, you're going to really compress that tendon, especially near the heel bone. But at the mid portion, right, it doesn't really matter too much. And doing some light stretching there should be very, very tolerable. Common causes for these two type of issues, right? So of course, there's overuse and overloading. So having poor load management and basically going or ramping up to 100% whilst doing nothing for a long period of time. Maybe there's also a little bit of biomechanic issues that could cause these two factors to occur. And also maybe just a lot of compressive load, especially for the insertional Achilles tendinopathy. So excessive kind of dorsiflexion and just kind of causing the tendon to be a little bit more sensitive. And I also find that for insertional Achilles tendinopathy or tendon issues around there, it very well could be related to the heel bone itself not being able to invert and evert very well. So for some people, their heel bone here is very, very rigid and you can't actually move it invert and evert like this, right? So invert inwards or evert outwards, right? So it's very, very stiff, and that could actually be causing some tendon issues just because if you're not able to pronate your feet well, which I'll be talking about a little bit later, most of that loading is going straight into the Achilles. And as we know, for the insertion tendinopathy, you really, really don't want to stretch the life out of it. So what you want to actually do is kind of promote more of a neutral foot position. So doing stuff that is more in this neutral stance, right? Maybe you're doing isometrics in there to kind of start off with. So for the whole Achilles tendon rehab program, there's basically 4 phases. And for phase 1 is going to be isometrics. Phase 2 is going to be eccentrics. Phase 3, some plyometrics. So slowly building up that Achilles tendon volume. And finally, sport specific drills, or basically return to sport drills. Maybe it's a lot of changes of direction, cutting, jumping to ramp you up back into playing your sport. So now, assuming that you're in the early stage for Achilles tendon issues, I'll be showing you 6 different exercises to deal with this type of issue. So for the first one here is very, very simple. It's basically a wall sit, but with your heels up. So basically what we're going to do is get into 90-degree position in both knees and the hips, right? And then you're just trying to get your heels as high as possible so that you're really, really loading into those soleus muscles, right? Those calf muscles, and giving some loading into those Achilles. And for the second exercise here is going to be some single leg, straight leg calf raise iso holds. So very, very simple. You can just find a squat rack, right? You want to find a platform that you can basically put your midfoot on, right? So basically, or maybe your knuckles of the foot, right? And from here, you're just going to basically hold in this position, right? You're trying to get this left knee as high as possible into this hip flexion angle, and you're just going to hold it for time. So for, if you're having insertion Achilles tendinopathy, you do not want to try to drive your heels down as much as possible in this position, right? Because that's going to really have a lot of compressive load onto the heels area, just like show, because you don't want to really dorsiflex into it. But I'll recommend is you probably want to get some loading in this neutral position, or maybe even in this heels up position, okay? But for, let's say, mid portion Achilles tendinopathy, you can kind of work in 3 different ranges. So the first one, it could be like all the way down, right, with the straight leg, right, really trying to squeeze your quads as hard as possible, right? And then you can get into neutral position, right, with your heels basically the same height as your forefoot, and finally your heels above your forefoot in this position. And of course, afterwards, once you feel much more comfortable, then you can use weight plate, right? And you can just kind of basically load it here, right? Just try to load it on the side in this neutral position, bottom position, not for insertion Achilles tendinopathy, and above, where your heels are higher than the forefoot. And afterwards, for the third exercise, is basically the same setup, but you can do it with a bent leg. So if we're doing it like this, right, we're just gonna bend our knees a little bit, right? And then if it's for insertion Achilles tendinopathy, you do not want to do this. Mid portion is completely fine. You're gonna squat down into maybe a quarter squat, and then try to drive your heels down as much as possible. And you're just going to be holding this position for the allotted amount of time. Maybe it's like 45 to 60 seconds, right? And then for insertional and mid portion Achilles tendinopathy, then you can get it a little bit higher, right? In this neutral position. And finally, if you really want to target it, then you can try to get your heels up as high as possible, right? While staying in this quarter squat position. So your quads will be lit up, your Achilles, your calves will be lit up as well. And we're just really trying to introduce some gentle loading into those lower limb complex. And now for the fourth exercise, this is an exercise variation that I really, really enjoy, and it's the supine calf bridge. So what you want to do is you're basically going to lie on your back, right, in this kind of position. And from here, you want to find a distance between your heels and your butt to not be too far or too close, because if it's too close, right, you can't really get your heels up in this position, and you won't feel it much in the Achilles and calves complex. But if you put it too far, your knuckles or your forefoot here are not going to be able to touch the floor, okay? So you want to find a good distance for here. So maybe for me, it's around here. And what you want to do is you want to make sure your lower back is flat on the floor. So you really want to try to kind of almost tilt, so you feel your tailbone being lifted up a little bit. So right here, if you can see it, is literally a credit card for it to slide through, okay? And from here, what you want is, after you do that, right, you're gonna lift up your heels as high as possible. So for me, currently, it's only going to be this high, right? And you should feel a good loading into the Achilles, into the calves, and you're just going to be holding this for 45 to 60 seconds to kind of start off with. It's going to get your Achilles fired up, your calves are going to be fired up in this shortened position. And for the fifth one here, what you can do is just find a foam roller. This is basically a very, very similar variation to the supine calf bridge, like how we did it earlier. What you want to do is you're just gonna find a foam roller, right? You're gonna try to put the knuckles or the forefoot on the foam roller like so. You just find a good distance here, right? And then what you want to do is just basically keep it lifted off just for a credit card to slide through. And then you're going to feel your hamstrings, right? And most people, what they will do with the heels is that they'll drop it down, okay? That's not what you want. As high as possible, so then you're loading the calves, the hamstrings, which will be a really, really good exercise, and it will probably light up those 2 areas very, very well. And for the last variation is just basically a straight leg or bent leg variation, isometric with the leg press machine. So of course you can do it with 1 leg, you can do it with 2 legs, right? You can kind of do it in this bent leg variation, or you can do it in completely straight leg, right? And trying to get your heels up as high as possible, or maybe in neutral position, right? Or just trying to drive your heels down as well, but that is not recommended if you're having insertional Achilles tendinopathy issue. So try to usually just be in this neutral position or trying to get your heels up as high as possible. And you're just going to hold this for the allotted amount of time. Maybe it's like 45 to 60 seconds. Quick interruption here. If you're an athlete who's tired of being injured, slow, and immobile, check out the link in group description below for exclusive access to programs, content, and weekly calls, and you get all that for free. Back to the video. So hopefully the prior isometric stuff is starting to make more sense. And if you're ready to take the next step, then you can check out the Gains Chamber community. It's completely for free, and I've basically got a full Achilles rehab program within it and everything laid out within it. So if you're wanting to really take the next step and commit to it, check out the Gains Chamber community in the group description below. So hopefully you guys recall that I mentioned about the heel bone. If they don't move too well, it could be causing some Achilles issues. So I'm just really here trying to teach you guys how to pronate your foot properly as well. So you guys can start with this variation, which is a half pronation reps. So what you're wanting to do is basically start with your knees always kind of behind your heels. So if I show my left one here, right, and then you want to basically shift your hips back, right, in this kind of stagger stance. And from here, you're just trying to drive your knees a little forward, right? And about there, that's enough, right? Where your knees are basically stacked right above the toes. And from here, you're just gonna slowly go back. So if I were to put something like a tissue paper here or a pair of socks, right? You should feel, right, when I'm kind of going forward, right? The pressure should be going up from the outside of the heels here, right? And slowly going to around the midfoot area. So if I start here, I should feel most of my weight to be on the lateral border of the heel, so on the outside. And when I kind of try to just drive my knees forward slowly, I should feel the arch slowly melting into the floor, right? I just want you to feel the sensation of it. You guys are not trying to muscle your way through. You're just really trying to feel that pressure going from the outside border of the heel and then going to the midfoot of the arch and then going back. And then afterwards, we can really progress into some full pronation reps. So I've basically got the sock here, right? I'm going to put it right underneath the arch here, just like shown. And what you're wanting to do, you should be able to sense the sock being there in this position with your knees behind your heels. And from here, I want you to really drive your knees forward, right? Trying to keep going forward, right? And you should feel, right, the arch basically melting into the sock. But one thing you want to remember is you want to keep your toes relaxed. I see some people when they're doing it, they'll be really gripping the floor hard when I'm going forward and my toes basically become white. That's exactly not what you want, all right? We're just really wanting to transfer our body weight from back to forward and then back without much muscular strategies, okay? So we're gonna stand in stagger stance, right? You should sense the sock, and then you're on the heels, knees behind it. Slowly push your knees forward without gripping your toes. And when you feel like you're almost at the end range, right, just slowly go back into it. And then you should feel the pressure now being on the outside border of the foot. When I kind of move forward slowly, then I should feel now more of my pressure being on the big toe, or basically the bottom of the big toe, and the arch melting at the same time. And then from here, I'm just going to slowly come back. So what I mean by the base of the big toe is going to be basically at here, okay? So the tripod of the foot. And finally, if you really want to progress it, then you can kind of do this half kneeling pronation and supination, which is basically a combination of the two. So right here, if I were to show it, I'm just going to use the sock again, once again. This is just, if you're not really feeling the bones moving, or you don't really feel the pressure going from outside to the inside of the foot and then outside, or maybe you don't feel the arch melting into the floor, then you can kind of do this variation, okay? So you're going to start in this half kneeling position, and what you're wanting to do, you're just basically wanting to turn the torso, okay? So let's say I will start with kind of turning the torso towards the camera, right? And naturally, your knees will be kind of going forward a little bit, right? And then you should really actually feel maybe like a little bit of an adductor groin stretch here, but more importantly, the arch kind of melting into this sock here, right? You're just gonna put it right here. You don't need to on purposely drive your knees forward. Just you turning the torso will be able to get that effect. And then you're going to turn back the other way. So now my body is trying to face straight against the wall, right? And you're going to feel your knees slightly going back and the pressure of the feet now being on the outside of the heel, okay? So when you're kind of going back, right, you don't want your knees to kind of shoot back like this, right? Just try to maintain around a similar spot. It might go back just a teeny bit. That's completely fine and normal. And you're gonna just basically wrap out here, right? Trying to really turn the torso towards the camera, then away, towards, and away. Maybe it's gonna be 3 seconds towards this way, then 3 seconds back. So hopefully up to this part of the video, you're able to learn how to pronate your foot a little bit better to alleviate some of that loading off the Achilles. And I'm just wondering whether you've dealt with Achilles pain like this before. If so, I would like to know what is the most frustrating part for you. And just let me know in the comments below. And now for some additional supplementation exercises that you can do in the early stage Achilles rehab. There are 3 exercises that you can do that I like quite a lot as well. So the first one here is the tib raise pronation and supination. So I'm just basically going to get my butt straight against the wall, my lower back not touching the wall at all. My hands going to be on my knees, and my knees are going to be locked out completely straight. And now I'm going to start with basically on the outside border of my foot, right? I'm going to try to get a tib raise, right? Trying to get it as high as possible. And then trying to get my big toe down, right? And trying to really pronate the foot. And then you're going to really try to get out into this. So you can really bang out some reps here. Going to be a really, really good start to just kind of introduce some gentle loading into tib area, the ankle, just trying to really get the ankle joint grooving better. And also some gentle, very gentle loading into the Achilles. And for the next thing here is going to be the toe yoga. I'm not sure if you guys have seen this before, but this is going to be super good in improving the foot stability. So it could really reduce some of the Achilles tendon loading. So what you basically wanted to do, right? You're going to sit down, right? And I'm going to show you unassisted first. So basically you're trying to bring up these 4 toes as high as possible. And then you're trying to bring the big toe up as high as possible. So you're trying to really get this coordination down, right? And initially, it might be very, very difficult for you to start off with. So what you might need to do is initially you might need to press down on the big toe to kind of lift these 4 toes up. And then when you're trying to lift the big toe up, you're trying to press the 4 toes down. And eventually, after some practice, you should be able to get this kind of coordination down with the toes. And for the third and final exercise here is the squatted walking. You can hold a kettlebell or dumbbell in a goblet style to do this as well. So basically what you want to do is to squat down into a quarter squat. And what you want to do is basically taking slow steps and trying to really drive your knees forward whilst walking in this upright position so that you're really loading the Achilles and the quads, all right? So I'm going to show you a few reps, right? You can really try to get a kettlebell with it as well. So it's going to look like this, right? You're just really trying to roll your foot forward, right? Upright torso and just walking forward. So now you have the exact steps to start fixing your Achilles pain, but the key here is consistency. If you start staying patient and following the exercise that I've shown earlier, you're going to feel a massive difference in how your ankle, your Achilles, and your foot feels. And this is going to help a lot with your running, jumping, and sprinting. Of course, there's going to be a mid-stage and later stage Achilles rehab as well. So if you want the complete roadmap to really rehab your Achilles pain, especially in the early stage, and with all of the exercise laid out for you and my personal support, then you can join the Gains Chamber community in the group description below, and hopefully I'll see you on the inside.